Greetings from the set of Metro and More at Metropolitan Community College, serving more than 50,000 students with over 120 programs at our 8 locations in the daytime, evening, weekends, or online. And I'm your host, Kent Pavelka. Welcome again to Metro and More of what you need to know about Metropolitan Community College. In the next half hour, we're going to be talking about a relationship between Metropolitan Community College and Millard Public Schools, the Millard Public Schools Career Academy and Dual Enrollment, with Dr. Stacy Ocander back on the program. Stacy is the Dean of Health and Public Services at Metro.
Good morning.
Good to see you.
Thank you.
And Barb Waller on the show for the first time from Millard, the Coordinator of Career and Technical Education Programs at Millard Public Schools. Great to have both you ladies on this show.
Thank you.
And Stacy, it's been a while.
It has.
Long enough that I'll ask you just to reiterate a little bit about your job at Metro, what all you do in your position.
You bet. I am the Dean of Health and Public Services at the college, so we have nursing, respiratory therapy, dental assisting, fire science, paramedicine, criminal justice, the career academies, those relationships, a wide variety of things. I'm in my 8th year, I believe, here at the college, so it's been great.
Good to see you again.
Thank you.
And we're here to talk about the career academies, part of all those responsibilities. Barb, you've got a long title. What do you do at Millard Public Schools with relationship to your title?
My role as Career and Technical Education Coordinator is to work with all of our dual enrollment programs and any other career and technical education opportunity for our students. So I'm the liaison between Millard Public Schools and Metropolitan Community College for not only the academies that are hosted in our district, but also the academies that are hosted by the college.
You know, there are a lot of folks who are ignorant. Seems like a harsh word, but it's not. Just but people that don't understand that this concept is going on between higher education, post-secondary education, and high schools. This career academy concept and dual enrollment and even a freestanding high school for Millard for all this. Just kind of sort all that out as we begin our discussion. Both of you can chime in here.
You bet. I'd say it's probably more that they're uninformed. It's sometimes
That's a better word.
Yeah, it's sometimes our best kept secret, what we do and the relationships that we have. I think in the past people have been used to, you go to high school, you graduate, then you go to college, and you decide are you going to a 2-year or a 4-year, and that's your path.
Right.
Education is no longer that way, especially not the relationships between higher education and the K-12 system. And people will use P16 and all these other phrases to count all the years of education in together. It's really marrying the best of both institutions at both level of education and teaching students and families how to be really good consumers. We can't all afford large tuition. We don't want to pay student loans the rest of our entire lives. So it's really talking about the relationship and how to provide the best world to our students while they're still in high school, preparing for that career field.
Yeah. So how pervasive are these relationships? I mean, is this, like for Millard, for example, how long have you been involved in having Millard High School students be heading toward a career and a post-secondary track?
I think our partnership goes back much longer than we all recognize because the college was way ahead in hosting academies on the college campus. We had students participating probably for 10 years or more coming to the campus for Metro's Career Academy programs. Our board and our strategic planning committees was looking at that kind of format and said we need more opportunities available. We found that we didn't have as many students going to campus as we would like just because of travel time, the loss of other instructional opportunities while they are traveling. And so we wanted to bring that experience onto our campus. We were seeking ways for students who learn maybe in different ways, who need that authentic experience to be successful. So we approached the college about bringing programs to our campus.
So that's where it started, the career academies at Metro, and now we're Metro's at Millard, basically.
Correct.
But Millard's taken it another step with Horizon High School.
Yes, we actually have 5 career academies. 3 of them are hosted at Horizon High School, And those 3 primarily because they needed special equipment, special setups, and we couldn't start them until we built the high school and equipped the classrooms. So we worked very closely with Stacy when we were developing the plans for Horizon High School and for the classroom, so that we knew that our classroom would meet the specifications that the college would need in order to approve our program.
So how long has Horizon High School been a reality?
This would be the fourth year.
Yeah.
4th year. And just so folks understand how that works, the student ends up half the day at Horizon High School, is that right?
They do.
Yeah.
They attend half day at Horizon High School in the academy program and the other half day at their home high school, completing their other graduation requirements.
Yeah.
We have it set up so that juniors, it's a 2-year program, juniors attend the academy in the morning and then return to their building in the afternoon for their other courses. Seniors attend academy in the afternoon, and then that allows them to be dismissed when it's time to go on to do their clinicals and ride-along and internship experiences.
And what are the areas of study and focus that these students can take?
We host 3 academies at Horizon, distribution, logistics management, and culinary. However, our focus today is our health science academy, and the students complete a range of courses in their junior year that prepare them for a more focused study in their senior year. So their junior year, they're taking anatomy and physiology, medical terminology, ethics, thing on my list here.
No, that's fine.
Right, and then they track.
Yeah.
From that, then their senior year, they can track into EMT or the CNA, the pre-nursing, medical science area.
So Metro is involved in one of the 3 academies at Horizon?
Actually, Metro's involved in all
Right.
of our academy programs.
Okay.
Which is, it's a great arrangement. I think the thing that's really important for people to remember is that these are truly college courses. In no way are the courses or the curriculum watered down. The objectives, their syllabus matches our syllabus. I've been very fortunate with Barb that I've been involved in the hiring of their people. So I know that their teachers, their faculty meet the same requirements we would require in our program. Because that's really the depth of the program and the relationship, just like she mentioned with having to have these specialized labs. Those students have the same exposure to equipment that our students do coming on our campus. And that's critical because these are industry certificates, they're national certificates, they're boards that these students take, and then those credits need to transfer because they are truly college credits. And so I think it's important that people understand this isn't just something to fill a student's time their junior and senior year. This is a rigorous set of curriculum and a rigorous set of rules that these students have to follow. In our area, they all have to be background checked, just like we require our college students to, because when they're doing ride time with an ambulance or they're out in a long-term care facility, they're expected to meet the same standard that we expect every student on our campus and in our programs to meet.
Yeah.
They fill out an application. I mean, it's very, very much involved, and that's the level of expectation that we have for the students, the parents, and the district, and ourselves.
So let's certainly disabuse people of the notion that this is an alternative high school in the classic
Yeah.
sense. On the contrary, these are gifted students who have a real focus, right? I mean, who are the students who take advantage of these opportunities?
We're actually seeking to serve an average student who may, they're performing successfully, but maybe have lacked focus, and they're seeking focus. And we certainly have had no problem with applicants to the program. We have more than we can accept. They are good students, but they are good because they have found an area where they can put their energies and they are interested in focus.
How do you identify them in those terms?
It's a challenge. We have an application process. It is self-nominating on the part of the students. They complete an application. They also complete an interview, and really the interview is the telltale sign. We're seeking questions or seeking answers to questions that tell us what their commitment is, perhaps what other experience they may have had that will bring them to a healthcare field. We've learned to distinguish between the student who has a genuine commitment at heart and the student who says, well, my mom and dad thought it would be a good idea.
Right.
Because that student is probably not the one that's going to focus.
Yeah,
we
here-
do have an application there.
And there you see it right there. And so we've got opportunities for folks to get on the internet and take a look at some of this material.
It is, yes.
Millard, there's the website, mpsomaha.org/academies, Millard Public Schools. Let's just back up a second, and Stacy, talk a little bit in general from the Metropolitan Community College perspective about, why this is important to focus on students before they graduate, and because this is a multifaceted operation as far as Metropolitan Community College is concerned. I mean, you have classes on campus. You're at Millard. Why is this important? And give us the breadth of the operation.
Right. I think especially in the health science area, not everyone belongs in medicine by any means. And Barb alluded to that a minute ago, and she said just because your parents think you should be in healthcare does not mean you should be in healthcare. Students in the academies, whether it's at Millard or wherever, take our classes at a reduced tuition rate. What a better way of discovering what are you truly interested in versus graduating from high school, having never taken a college course, arriving on campus and starting down a road like for us with a hard science core, a hard math core to get into the health area, and then suddenly deciding after a year of paying the tuition and being in these classes, I'm not at all interested in healthcare whatsoever. I really want to back up, and I think I'm going to go into business instead. There's not a lot of credits that transfer between healthcare and business when you get discipline specific. And so it truly is taking those students who have said, I have an interest in this. I'm going to pursue this road of health sciences. It's a lot of navigation. They operate on a semester system. We operate on a quarter system. So it's not just specific to our area, like in the records office at the college, understanding that we may say grades were due in November because that's when the fall quarter ended, but we will have our career academy classes that won't be reporting grades until December. So it's truly, the relationship is critical between the K-12 system and the college system in order for it to be successful. And then, our ultimate goal is that those students will eventually then, upon graduation, come to Metro, finish that second year, and then transfer to a four-year institution to finish out their baccalaureate degree. That's always been our goal. But yet they come here knowing what they want to do. They have that focus. They're not sitting at high school board trying to figure out what to do with themselves. They're earning industry certificates. When these students in our area turn 18, 18 is a key number for some of the industry certificates or the boards like the EMT or medication aid.
Minimum age. Yeah.
Minimum age, right, thank you. They've earned these certificates, so they're able to be employable. At 16, they can work as a certified nurse assistant once they've completed the curriculum and passed their tests, their state tests. Medication aid at 18, which ups their salary. An EMT at 18. So these are employable positions for students to really get into and realize that this is what I want to do. And for us, the CNA is a prereq to get into any of our other health programs. So we're really serving two roles while they're still in the high school setting.
What a great opportunity. You get out of high school and you've got a year of two that's required already under your belt at Metro. You got 1 year to go instead of two, right?
Right.
And at a more attractive cost.
Very, very much more attractive.
And you've engaged students who otherwise may not have gotten engaged relative to higher education or career, correct?
Yep, they've been able to test the field. They now know that they want it. They have a head start. They have the ability to earn a wage at a higher rate than other students while they pursue additional education. And they're ahead on the additional education. So it's just a win.
Sure is, win, win, win.
Yeah.
We have a video, this is a part of a video that talks a little bit about the Health Services Academy at Horizon High School. We'll roll that and let you talk about it a little bit, Barb, as we watch it. But it's pretty exciting stuff. How many students do you have?
Students in the Health Sciences
We
Academy
have
at Horizon High School
enrolled in the
prepare for a
academy.
high-wage,
Our
high-demand
capacity is
career
36
in the healthcare and medical fields.
in the year 2 program.
Students study human
We
anatomy,
accept
physiology,
about
diseases,
40 to 44
nutrition,
in year
and
1,
many other
knowing there will
courses.
be some
They become
addition.
certified in
And
CPR
then-
first
Students
aid,
here are
get certified
These are
as
actually
a
year
nursing
1
assistant,
students who are
begin
learning the
emergency medical
CPR,
technician
one of the
training,
prerequisite
and
courses.
complete a one-year
So CPR
internship.
AED certification that
We
they
encourage you
have
to
to
look
have
into these
before they
exciting
can
and diverse
proceed into
career academy opportunities
EMT
available
or
at Millard's High
CNA.
School.
All of our
Whether you know
students
exactly what
who
you
complete year 1 complete EMT and CNA. So they have both credentials when they finish. Now they're not finished as an EMT. They have additional coursework to take, but they have the first basic course completed.
And you said 36 students? So
In each year.
In each
In
year.
each year.
So how big is the high school?
Well, the high school does have a general ed wing to the building, and so it serves about 150
I see.
general ed students and then about 150 total academy students.
Yeah.
72 of them being health science.
Right.
It is the largest academy program.
And you draw from all the Millard schools.
We do
Yeah.
pretty much equally from all 3 high schools.
It's been interesting. We actually, when we started this relationship, one of the other things that we started doing was some career exploration with the middle school students. So what happens in the 6th grade are the students come and spend a full day with our health science students at the college and then with our faculty. And they explore every single one of those areas, and they're actually doing hands-on stuff all day with our students. It's a remarkable experience to see our college students teaching these middle school students, and then the middle school teachers interacting with our college faculty, because it really begins the conversation, and you can see the students who enjoy that day thoroughly. And so then when I see them back now for the first time, they've started to progress into it'll be their junior year in the Health Science Academy. It's interesting to see that was really their first baptism by fire, shall we say, into their exploration of it. And we're doing that now in culinary as well, to really say, in middle school, start thinking about some of these things, and what you may want to end up doing.
Yeah. Why wouldn't this model be applicable to all high school students in one way or another? I'm not saying necessarily with a relationship with Metro, but with some sort of goal beyond high school and with some sort of post-secondary marriage of the high school experience.
It would benefit all of our students if they were to select a focus area of study and be able to pursue it. We do have some other options available for students to earn dual credit and complete a sequence of courses that will help them make the connections. None of them are as intensive 2-year programs as our academy programs are, but would definitely be a benefit. There are some barriers. One is hiring teachers who have the college approved credential in particular. And in addition, some folks have said, well, why don't you just hire the college faculty? Well, we would like to do that too, but then there's a certification issue that we need to deal with. So it's taken a lot of coordination to bridge those gaps and to match good, strong instructors with the credentials that we need.
Just seems to me that this dovetails with the larger conversation, which over the last, 10, 20 years has talked about American education is falling behind the rest of the world. And doesn't a lot of that have to do with motivation on the part of the students themselves at a younger age, and what do I want to do, and do I have any opportunities, and to really focus on anything?
Right. I think I always use the term to see one is to want to be one. I can sit all day long and talk to kids about, don't you want to be a nurse or a respiratory therapist or whatever, or a paramedic, but to actually see one and have that person that has a strong interest in that area teaching those students, education becomes very exciting. Because when they learn CPR and they're learning to do different things, roll a patient or work with the equipment, we make them wear their uniforms. So in CNA, they wear scrubs. In the EMT program, they have to wear their blues and their Millard Public Schools polos. We want them to beginning to connect that education is active learning. It's not just sitting and listening to someone talking. If we can get students engaged in that thought process at a very, very young age and continue to build on that, I of course am biased. I think every single school district should have this model.
I was going to say.
I truly do, because otherwise you will lose students. And when we lose students, we lose what they call brain drain. I mean, all these things happen. So you really have to start meeting students, and we've done a good job, but meeting students where they're at and how they learn. And that takes a lot of work, a lot of coordination, but what's the alternative? You lose them.
Well, I'm glad you said that, because to me it seemed like this would be a real opportunity, for example, with OPS. But it takes work, takes money, I guess, I don't know. But another good point, though, is I think all of us who've gotten into a career, probably our interest in whatever that is was peaked at a real young age outside the classroom somehow. And that's what we're talking about. seeing and being around the field that eventually excites you and motivates you, right?
Right, and I think too, our relationship, I can't speak enough about what a great relationship it has been. When there have been barriers, we've come together and said, okay, how do we address that? You know, how do we make that work? Do we need to write a different course? Because say genetics is at the senior level at college and we need to have an introductory genetics course. So, you know, really talking about where are the students at, what is the level of learning, and yes, we may have always looked at genetics as senior level, but if they need an introduction to genetics, for instance, I'm using that just as an example, to transfer into a pre-med program, then let's talk about writing that curriculum. So I don't know that we've ever said, absolutely not, can't happen, we refuse to do that. There's been a lot of conversation to figure out how to make that work. And we've learned a lot.
We have. We've learned a lot as we've gone in. The best part has been that Stacy is a phone call away. Particularly when we were hiring, we added a second teacher. This is who we're considering. That teacher did not have all of the credentials that we needed right away, but agreed to get them. And so we could put him in a position where he was monitored while he continued his coursework. So it's been
great, yeah.
Yeah, it's wonderful. We always have a time issue on this show. I don't want to direct the conversation anywhere except where you want to take it here. Just about 10 minutes left or less. What do you want to talk about relative to this relationship and the topic in general that I haven't brought up?
I think parents are a component in the entire success of the program. Now, I mentioned when we were talking about interviews, the student who says, well, my mom and dad thought it would be a good idea. It never hurts if a parent encourages the child as long as they are also interested in the field. But the next piece is for parents to recognize that the opportunity is like an insurance policy for them. If they feel an obligation to provide post-secondary education for their children, then testing the waters in a dual enrollment program gives them some good insurance to know that their future investment is going to be something that will lead to persisting to degree completion and employment. So I think that's a message that we want
You want to encourage parents, in other words.
to know. You bet.
Encourage parents to encourage students.
Encourage parents to encourage students. Consider it an insurance policy and investment on future education for your children as well.
Barb and I were speaking earlier. Last week was the parent meeting to get students enrolled for the next year. And it was the first time that we had parents of graduates of the health science program come back in and speak to future students and their parents. You know, and I can't imagine what those
Great.
conversations must have been like for those students.
They were excited, I'm
Oh,
sure.
they were. And the parents volunteered to speak to the new parents. So
What
that
were they?
was-
What'd they say about it?
well, their children are now seniors in a in a baccalaureate degree program, and they're successful, confident in what they're doing, and they have continued to pursue their studies. More than anything, just the success and confidence of their children.
Yeah. What's more exciting as a parent than to see your child get excited about something beyond childhood?
Right, exactly. I use the example, we had a student from another high school this summer who enrolled in the EMT class on our campus. And knowing that he could sit for boards but can't find out the results of those boards till his 18th birthday, which is in March. Now, I wouldn't have the patience as a parent or a student to wait 6 months to find out how I did on boards. But I bring that up because what has been critical is the connection he made with our faculty member who is a supervisor out at one of the ambulance services in town. Every Monday that high school student goes out and works at that facility, not for pay, but just for learning, from 4 until 10 at night, every single Monday. And his parents said that never would have happened. We were just like, let's get through high school, let's figure out what you want to do at that point. And he asked if he could still go to that service every Monday to continue to learn. You know, and so that's because something sparked his interest. He made a connection with the faculty, with other students in the field, and will continue on and has already made application to the paramedic program when he graduates from his high school in May. And that's what we're talking about, is that not just the relationship between our institutions, but the students to the faculty to the K-12 teachers. I mean, all the way around.
Just the focus. If you walked into a classroom, you could ask any student why they're there, what they're going to do when they graduate, how they will use what they're learning, and every one of them will just, they're
They're on target.
Yeah, they're
Yeah,
right
they
on
know.
target.
What about costs? Do the students at Horizon have additional costs with this?
There is cost to the tuition in the general agreement between the college and our public school systems. Because the public school system is providing the teacher, the tuition is $25 per course.
Per credit hour.
No, per course.
Per course.
Yes.
See?
Now, it's
She's
reduced from when it
Okay.
started, it was per credit hour.
Wow.
Now per course, unless
And you're
there's.
talking, what, three credit hours per course? So,
Oh, so in our area, it's 6.5, some are 9.
Yeah,
well,
the
that's
EMT
way
and
cheaper than
CNA,
per hour.
Yeah, you bet, a
Yeah,
lot cheaper.
Yeah.
In the case of EMT, we do have some staff from the college working with our instructor. So then the rate of insurance is a little higher. It's $31 a credit hour then. So still a savings. But in addition, the Millard Public Schools Foundation has graciously agreed to provide a scholarship for
Great.
each of our students.
Great.
They will pay 50% of the reduced rate tuition as long as the
amazing?
student maintains a B average.
That's great. Where do you see all this going from the Metro point of view and from the Millard point of view?
Right now, our biggest problem, which is our best problem, is being able to accept more students into the academy and figuring out how between the two of us we can strategically plan to meet those needs. We're meeting the needs from the conversation years ago. We're no longer meeting the needs of the interest, and that's where we really need to have those
What do you
strategic
what do you
conversations.
need to make to meet those needs? Just more space or more
We need
money?
to double our classrooms and double our staff because we could serve that many more students. Now, we believe that we can serve that many more students because it is the program that we have available and the one that they know. But it may be that we need to look at a different configuration in the health science field. We talked about respiratory therapy as
Right.
an example, or some other certification that we have not included.
Add to
So
the
we would
options.
add to the options. Yep.
The good thing is we now have the history, which seems kind of funny because it seems like we just had these conversations the other day, but we actually related to the age of my son, and he was small when we started it, and now he's 13. So
Yeah.
we're like, we've been on this road a while, but really talking about how to grow, what areas to grow in, and then expanding on that, and what students need and want. You know, so those are ongoing conversations.
What are the impediments to that? School boards, or I mean, how do we get this as big as it needs to be?
I think it's finding, first of all, what the students are interested in, and then finding the talent within the faculty. Because again, remember, we're dealing with a double-edged sword here. They have to meet the college requirements to teach college classes. Our college faculty have to meet the requirements of the State Board of Education, Department of Education, in order to teach in the high school.
Right.
Not everybody should teach in a high school, I can promise you that, myself included. And not every high school teacher should teach college. So you're really finding the magic person to do that.
Yeah, that's not a money issue. That's a human resource
Absolutely.
consideration.
And then doing it well.
Yeah, sure. 1 minute left. Anything you want to add that I've not brought attention to?
The only thing I could add is thank you to the college for the support that they've provided. It is an opportunity for our students, but we could not do it without the support of the college.
Yeah, and I think it goes back to Millard. We are involved in all the conversations. So if it's a student issue or whatever, it's not like thanks for helping us get started and now you're off on your own. It's not. I mean, the smallest of issues to the biggest of issues, it's a phone call or an email. And that's why it works.
Disciplinary measures or anything
Absolutely.
else.
Very good. Barb, thank you. Stacy, thank you.
Thank you.
Great discussion and a great program. Appreciate it very much. And thank you for being with us again on Metro and More. Our goal is to better acquaint you with the mission, leadership, and reach of the college. I'm Kent Pavelka for Metropolitan Community College.
Whatever option fits best, Metropolitan Community College is focused on you.
Come experience it for yourself. Metropolitan Community College.